one of the questions that we tried to assess and to ask was whether or not diet quality had an impact on future frailty incidents. I'm Dr. Abigail Goshen, and I'm from the Department of Epidemiology and Preventive Medicine, School of Public Health, Faculty of Medicine of the University of Tel Aviv. And the article title that I just published is Diet Quality and Incident of Frailty in Adults 65 Years or Older, the Israeli Longitudinal Study of Aging. The paper is going to be released at the December 2023 issue of Mayo Clinic Proceedings. So generally, these are some of the results I got on my PhD thesis, which was a really comprehensive cohort study. We studied older adults over the age of 65 who took part in our national representative survey of older adults that was conducted in Israel between 2005 to 2006. Survivor from these years, we reached out and contacted them and interviewed them between 2017 to 2019, a very extensive interview and functional assessment that was conducted with more than 600 participants. We always say eat better, you should eat more vegetables and so on, but whether or not it has a scientific basis, this is what we were asking. What was the association between the general diet quality as a general, not certain food groups, like proteins or vegetables, but looking at a person whole plate and giving it a healthy eating index score. We tried to assess whether or not it was associated with frailty, incidence of frailty later on. The follow-up time here was really extensive, and it was 12 years. And the age group that we studied was a very old age group. The mean age at the baseline was 75, and at follow-up it was already 85. So when we looked at that population, we found almost 50% of the population, meaning almost 250 participants, were classified as frail, which means that they were in a vulnerable situation with a multiple syndrome that is called frailty, which was quite interesting because they were living in the community. They were considered healthy. They approved that we will come and interview them in their house. And it was surprising the numbers of almost 50% of them to be recognized with frailty as a syndrome. The second thing was when we tried to assess the relationship between their basic health eating index, when we just at baseline, and then related to the frailty outcome that we saw during the follow-up interview, we saw that the connection, we saw the association, and we saw that improved diet quality was inversely associated with frailty incident in a dose-dependent manner. Moreover, we found that even after adjusting to sociodemographic changes, that obviously has an impact, and other lifestyle factors like doing physical activity, not smoking, still, even after these adjustments, we thought that a higher diet quality score was associated with decreased odds of 43 percentage, even for the upper thirtile of the people who ate a better diet quality compared to the ones that ate in the lowest thirtile of the healthy index score. I think that the important thing is about the study is that this is a comprehensive, nationally representative cohorts from older adulthood to oldest old age group. It's a very diverse cohort with Jewish, Israelis, Arabs community, It's a very diverse population that we live in Israel, and it is a nationally representative cohort. I think that the result, if you will read the article, you will see the paper, you will see that the consistent association that we see between a higher diet quality and lower likelihood of developing frailty in 12 years, after 12 years, is quite impressive. Furthermore, I think that what is the most interesting that even that we see that even a moderate change in diet quality, meaning that sometimes even helping participants or patients to do a moderate change in their everyday diet has an impact. That means that it's not only if you eat very, very, very healthy, then you get the positive side of the eating habits. It seems like that even a moderate change of even 8 point score, meaning small changes in your everyday diet, has a meaningful impact. And that's an important take home message. And it's important because we use the index and it's a general index, meaning it's not only if you add certain food groups. It means that even, everyone has its own personal things that they likes better to eat or dislike. And it seems like that you can add these 8 points in each food group and still get the positive side of having a better diet quality. I think that's if I would say there's a sentence that it's the take home sentence is that I think that is it from the paper that we're publishing. I hope that you will read it and enjoy, and you will learn, learn more. Further research is obviously needed in order to assess better these association, but that's a start. So thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.